Okay, so pretend we don't work together, pretend that we're not in the same industry. Please explain what is clinical genetic testing?
Clinical genetic testing, it looks for changes either in your DNA or RNA that, when altered, can lead to human genetic disease. Clinical genetic testing is done in a CLIA-certified lab and has an ordering provider put in the test order. Depending where you are, this could be a physician, a nurse, or a genetic counselor. Picture genetics is actually a really unique thing. It is done in a CLIA-certified lab, just the way that all clinical genetic tests in the United States have to be, but it can be consumer initiated. This means somebody can go online and order the test on their own, but then on the back end is where a physician would come in and review the order to make sure it's appropriate. To give two examples of clinical genetic testing, one is cystic fibrosis and the other is sickle cell anemia. Both of these are conditions where you need a genetic change on both copies of that gene in order to be affected. So one would be passed down from one parent and the other change would be passed down from the other parent. Both of these conditions have come really far in the last few years of different treatment options, but they are still on carrier screening panels because they are a significant genetic disorder. Picture genetics also has the option to have a genetic counselor review test results. Many other consumer-initiated tests don't have that option. Usually these are not done in a CLIA-certified lab. There is no ordering provider at all.
Okay, lots of information. I'm so glad you're here to explain all of this. Can you now explain what clinical genetic testing can tell you and what it cannot tell you?
As I talked about, it can help with carrier screening if you're going to have a child. Also, if somebody already has a condition, is a child or an adult, that could be a genetic disorder, things like epilepsy or congenital heart defects, early onset cancer, all those can receive clinical grade genetic testing to try to identify what genetic disorders might be running in that family that also might be explaining the patient's symptoms. So again, when it comes to non-clinical genetic testing, these are again our likelihood ratios for the most part. This can be done in many ways, but one are called GWAS studies, so genome-wide association studies. So instead of just looking at your DNA, they're comparing that to either thousands or millions of other people to try to decide on likelihood ratios. So this is your likelihood that you might develop diabetes or have color blindness, but it's not the same thing as saying that you have an actual genetic disorder. And they can also tell you things of, are you one of those people that's going to think cilantro tastes really funky? That is a genetic change, but it's not a genetic condition. It can also tell you things like genetic ancestry, but they're not diagnosing something.